guys, welcome back to Medical Coding with Blue. Today's episode is all about if you have prior medical experience, does this help you to get in as a medical coder, or does it help you starting your career as a medical coder? If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay guys, so this person made this comment 8 months ago. I don't know how it slipped past me, but I was going through the messages this past week and I was like, oh, I don't know how I missed that one. But I did. And this is asking that very question. They are a medical professional and they want to come over into medical coding. I will say this first. Don't get your feelings hurt by what I say today, okay? Because of the simple fact that I need y'all to understand this. Medical coding is different than anything you're going to come across, okay? Whether you came in as a nurse or whether you came in as surgical tech or MA, CNA, LVN, LPN, whatever you came in as, medical coding is very different. And a lot of people erroneously think that, oh, I've had medical experience before, it should be really easy for me to do medical coding. Or even I have an MD, medical coding should be easy. No, it's not. It's a lot of rules. And sometimes when you think that way, when you think that, oh yes, this is easy, it makes it harder for you to understand because, again, here we go with the rules. And not everything is black and white. That's the thing about coding. Some of it is an art. Some of it literally is an art, and you have to figure it out. It involves a lot of critical thinking. And if you don't think that, or if you don't know that, it's going to make your transition into this career field much more harder than it needs to be. Okay, so let me go ahead and read this message and then we're going to get into it. So here we go. All right, so the message says, so I have a quick question, and it's never a quick question. When y'all tell me that, don't tell me that, because it's never a quick question. I have a quick question. I am a medical professional with a degree. I am a medical and surgical technologist in the field of ophthalmology with 20 years of clinical and surgical experience. I have a great deal of knowledge in medical diagnosis codes and surgical procedure codes and the application for nearly 20 years. 4 times already. 4 times. Well, we're not done yet. I'm needing to get into a non-patient facing career. Working remotely, of course you want to work remotely. And utilizing my very extensive education and medical background, medical coding seems like a very good fit for me. I would expect not to be treated as a no experience individual after passing my CPC due to my degree and extensive medical and surgical background. Any assessment of this advice? 8 times we were told about their medical experience or past medical experience and how they've worked in the medical and surgical side, the clinical side, 20 years, and all of these things in ophthalmology at that. If you're coming in with this kind of attitude, we got to put the brakes on that, okay? Because to me, if you're going to come in and you're going to demand that, oh, I should not be treated as somebody that's brand new. You will be treated as brand new. You will be put through the paces of somebody who's brand new and never been in the field before. And if you have pre-selected codes before, that is not the same as looking at a document and abstracting, meaning that you're selecting the codes when there's no codes available. You're going in cold. You're going in where you're having to look up, okay, here's the diagnosis here. Let me go look up the code. Let me make sure that that is the correct diagnosis code, that it's not actually a combination code. And then let me make sure that this code actually applies to the situation. And oh yeah, am I going to report a CPT code? Okay, I'm going to report CPT code, but does it need a modifier? And does the insurance that it's being falling under, right? This procedure, is it falling under? Is it going to take CPT or is it going to take HCPCS? That in lies the question. There's a lot of different things to this industry. Coming in hot with that kind of like, oh, I've got this and I'm going to expect not to be treated as somebody that's brand new with my CPC. Well, you've never been a coder before. There's a difference there. Now, you may have some exposure to codes, which is great. That means that you're going to have a little bit more of an edge, and that's okay. But that is not going to guarantee you that you are not going to get treated as somebody who's brand new, because technically you are brand new. It doesn't matter your background. Now, the fact that you have advanced medical terminology and you understand about surgical procedures, again, good things to put onto your resume, but it's not the end all be all. So let's get a realistic look about what it's like to get into medical coding. Everybody starts off the same. We're all grunts in the beginning. So if you don't understand that terminology, grunt means that you are at the bottom of the list. You are at the bottom of the barrel. You are starting from scratch. And everybody has to work their way up. Everybody does. It doesn't matter what your background is or where you came from or what you did before. And even when you do get experience and you're one of those people who says, well, at my old facility, we did it this way. No one cares. You have to do it based on what is applicable in that setting, for that facility, for that area or whatever. So everybody starts brand new. So when you have that bit of humbleness about you coming in, that's going to be a lot better for you, and you're going to be a lot more receptive, instead of immediately I'm going to put up this block because I know everything. No, ma'am, you don't know everything. You don't. And coming in with that kind of energy, it's not good. Okay, this is a great field. Medical coding, I always say this all the time, it is a great field. But already with the demands, oh, well, I want to work remotely. No idea what you're doing. Now, you may understand the electronic health record, and that's all fine and well, but what if, for instance, you worked in Epic and the place that you're working uses Cerner or uses eClinicalWorks? What are you going to do then? Okay, so you have to learn their electronic health record, okay? And not only that, now you're not going to be where you're having multiple choice like you would if you're taking a test. You actually have to be in the real world, and you're actually having to select these codes. And it's not about what the provider selects, because it doesn't matter what they select. If those codes are not applicable to that encounter or to that record, then you cannot pick them up. You have to make sure that everything does check out. And it doesn't matter if they say, well, this is what the provider wants. Again, if they are not documenting it, it didn't happen. So you're not going to pick it up. What you are going to do is you are going to use your coding knowledge and skill to be able to pick up what actually is there, what actually does reflect in the record. Because if you are strong-armed into, oh, well, the doctor wants this code, don't you change this code, and you send that code in, and it's your name that's on it, they're going to come ask you, why did you select it? And if you say, well, the provider said he wanted this code or she wanted this code, they're going to say that's not going to fly. Because if you have read the coding ethics, you would know that you have to make sure that you have to code what is there. And if something is wrong, we have to speak up. We have to, as medical coders, we have to be able to explain it to the people who need to understand this, our providers, the clinic administrator, and everybody else, so that everybody else gets on board with correct coding. Because that's what it's all about. All of the codes that we select affect the patient, it affects the provider. If the incorrect codes are being selected, then that claim is going to get denied. That patient may end up having to pay way more or way less for their procedures that they did, and that's not fair to the provider if the provider's not getting paid appropriately. So that's just something that you got to understand getting into this field. I wish I could get a hold of every single person before they pursue this and tell them that it's not all sunshine and daisies when you're getting in. And if you think that, yeah, I have all this experience, it should be easy for me. No, it's not. It's not. It is going to be the challenge of your life because while you may have really stellar medical terminology, anatomy, pathophysiology, and all of that is great. We wish everybody that was brand new had that. It doesn't necessarily translate to being able to understand the coding guidelines. It doesn't necessarily doesn't necessarily mean that you're going to understand the sequencing of coding and when certain rules apply, when other rules don't apply, and that kind of thing. It doesn't necessarily mean you're going to be able to grasp all of that. And so that's the thing that I wish you all would understand. and this whole dream life of, oh, I want to work remotely. Y'all think that that's the best thing in the world. It's not. It is for some people, and for some instances, yes, it's a great thing. But coming in brand new when you don't know what you're doing is going to compound everything else. And even if you started brand new and you said, well, my first job was a remote position and I have never worked in the office, how much are you missing then? That would be my question to you. You probably think that you're not missing out on anything, but I guarantee you there's something that you're missing out on. Something that could make you an even better coder. But you don't know this because you're at home or you're working remotely wherever you're working at, you know? And some people think that, oh yeah, I can do this and I can travel. I don't know why y'all think that. That is foolish. Because again, we have to be able to protect these records. And you trying to connect to Wi-Fi all willy-nilly, no, that doesn't work. That's a HIPAA violation waiting to happen. Literally. So that's just something that, you guys ought to know, because you can't be coming into this field all just demanding and thinking that you want this and you want that when there's so much more to it. Do people work remotely? Yes, but it's ideal when you have experience. I'm not saying that you could never work remotely. I'm just saying that it's ideal when you have experience and you're not going to need the help of somebody else. And if you have so much education like this and you need help and you can't ask for help, that's also a problem. Now, I have a difficult time myself asking for help. I often will not ask for help because of the simple fact that anytime you ask for help, everybody's got 100,000 excuses. But when you're the one who's asked to help somebody else, you're Janie or Johnny on the spot, and it's no big deal. In my case, I would rather figure it out by myself, but that's not always the best thing to do. And I'm telling you guys so that you can learn from me too. It's not always the best thing to do. Sometimes you should ask for help, and I am working on that. It's not the easiest thing to do. But when it comes to coding, when I have to ask for help on coding, because occasionally we'll have to ask for help on coding, there's only one person that I go to, and that's my friend Jessica. She is the only one, because when it comes to asking questions, I need somebody who meets my level or exceeds my level. And that's my friend Jessica because of all of her experience. She was my first real hands-on supervisor. And I had a supervisor before her, but we're not going to count that lady. But my friend Jessica, she taught me everything. She taught me about professional fees. She taught me everything. And she is one of those ones that can think of like coding clinics. Like she can go into coding clinic and CPT assistant, and she can like pull out like, oh yeah, there's this, there's that. I'm getting there now. But for the longest time, I always thought it was like a magic trick. Like, how does she do that? Now that I spend more time with it, now I get it. But she just knows a lot. And like I said, whenever I have to ask for help, I'll go to her. I won't go to anybody else, because again, you have to be able to match my knowledge or exceed my knowledge. And that's just the way that it is. But again, coming in with this kind of, I got 20 years. We know 20 years. That's great and fantastic, but it doesn't mean everything. Okay, so let's try to be a little humble, And I know maybe something I said upset somebody and they got their feelings hurt. And it's fine, guys. If you get your feelings hurt, there's nothing I can do. Just wait till you're out there in the real world. And it's even worse when, people are asking you, like, why did you select this code? When you're getting audited and you can't pass your audits, and then all of a sudden it's a problem because you thought you knew everything and you didn't ask anybody for help when you couldn't figure it out on your own, right? So that's just something that I hope that you guys consider that before you get into this. I'm not saying that it automatically makes you not able or capable, my nurses or my surgical techs or any of those people. I'm not saying that. What I am saying is we got to be a little bit more humble when we're coming into an industry when we think we know, but yet we don't know. And I hear from a lot of my audience members that, oh, well, I talked to this friend of mine and they're a nurse and they said something disparaging about coding. Or are they a coder? Well, no. Okay, well then why are you listening to that person? Well, because they're a nurse. Yeah, they're a nurse. They're in the field. Doesn't mean that they know. I wouldn't go to a dermatologist for an orthopedic problem. I'm just saying, two completely different things. Two completely different things. I would never do that, you know? So you have to think about when you're getting into this, the energy that you're bringing in and your willingness to say, okay, yes, I do have all of this education, but there's something about learning this coding stuff that's going to be a little bit more of a challenge. And it's okay to admit that it's a challenge. I've gotten into several several nurses who have gotten upset with me over the years, and they have said, "Well, no, I'm a nurse and I learned it in 4 months." No, you may have learned the broad strokes, but you don't understand in 4 months. There's no way. Not coding. You can buzz through a coding program, sure. They have 2-month programs. They have 8 weeks to 2 months, whatever. But they have those short programs like that, and people buzz through them all the time, thinking that they know and they don't know, and it's a hard reality when they get out in the real world, and then all of a sudden they give it up because, oh, well, I can't find a job anyway. No one wants to hire, and I'm a nurse, and okay, guys, think about that. Why? When you're coming in and you're getting tested and you're doing these assessment tests, just having an RN and all of that, it's not going to guarantee that you're going to pass those tests. Again, it may help, but it's not everything, okay? So that's just what I want to share today. Let's just be a little bit more humble coming into this field, because it's a big field. It is a big field with a lot of moving parts. It's got a lot of things. There's a lot of different positions in this career field too that involve different strengths. So if your strength is educating providers, that's fantastic. Learn the coding, then learn to educate providers. If you are into data analytics and you're coming over from a job that data analytics was a thing, like maybe accounting or teaching or something like that, that's something that you can transfer over into this field and marry up those skills into coding. There's a lot of things that you can do. We are very attention to detail. Medical coding, health information is a very detail-oriented field. If you miss out on the little details, if you misspell words, if you ignore grammar, which this person did throughout their post, and spelling, if you can't get that stuff right, it worries me for your career in coding. It really does, because again, you should not be messing up on something as simple and straightforward as written communication. With 20 years in your extensive education, I would think that that would not be an issue for you, but you demonstrated that it is. So that's something, again, written communication is so important. I did a post the other day because somebody was saying about details and being detail oriented, and one post was talking about somebody's name. The person was saying that they have their name mispronounced all the time, and so she says, when somebody mispronounces your name, you should correct that person. And then some people disagree and they say, oh, well, I don't take it as anything, it doesn't bother me anymore because I'm whatever about it. But no, it's true. Like, for example, my name is 4 letters, and yet people seem to mess that up royally. I even had one I'm not going to tell their credentials because it's embarrassing, but after 3 attempts of telling this person my name is not B-L-U-E, they spelled my name B-U-E. How you do that, I don't know. But that was that. That was it for me after that. With that person, I'm not dealing with it, guys. I'm not. I won't. Because when I tell you because it's about detail. You can't mess up detail. It does not matter. If you can't get that detail down, that's going to be a struggle for you throughout your career. And this is a career that it requires that. It requires it. It demands it, that you are detail oriented. I'm just saying. So with that said, that's my advice for today, guys. If you're coming in from a medical position, medical field, whatever, great. We welcome you. That's wonderful. But it's not everything. And it's not going to guarantee you a position. It's not going to guarantee you acceptance right away as far as like getting jobs and things like that. It's not going to do that. You still have to prove yourself. Everybody in the industry has to prove themselves. Everybody. Nobody gets away with just barely putting in any effort and still making a wonderful career. There's not a single person who has a wonderful career now, who says that they have a wonderful career, who can't tell you about a time or two where they struggled, or where they had to learn, or they had to, fall down, or where they failed. There's not a single one of us who takes this field seriously who will not have a story related to that. Every single one of us does. Okay? So, and it doesn't matter. We build knowledge over time. I'm just saying. With that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.